Hey everybody, Dr. Hill here at Advanced Animal Care Berea, and today we're going to be talking about preventative care for your cats and kittens to give them a healthy life.
All right, Dr. Hill, what is considered preventative care for my cat?
Yeah, so it's kind of just being preemptive about general health for your pet, and that ranges from their diet, that ranges to enrichment and toys and bedding and housing, and that also that spans here into the vet clinic for vaccines, for just getting general checkups on your pet to make sure that everything looks okay, some dental care, and even stuff like flea tick preventatives, intestinal parasite deworming, all of that good stuff.
So, how can preventative care extend the life and improve the health of my cat?
Yeah, so the most proactive owners and the owners that seem to be the biggest on making sure that their cat is well cared for in their veterinary health, but then also in their home life, those pets tend to live the longest. And so really just making sure you're on top of everything, their vaccines, their preventions, their diets, what we're providing for them at home in terms of enrichment really just makes a general impact on their overall health and lifespan.
So, specifically, what types of preventative care do you recommend?
So when they're little, like Dwight here, this is our newest little clinic cat here. He's a little kitten here. We like to see guys that are this age just about every 3 weeks, starting at about 6 weeks old. We do general checks on them. We test them for things like feline immunodeficiency virus and feline leukemia virus to make sure that they don't have those. And we get them started on their vaccine series that we do about every 3 weeks until they're about 4 months of age. And what we're trying to do is, establish a healthy immune system for these guys with those vaccines so that they live long, healthy lives. And we usually get them started on some preventions. I've got one here that we really love for our younger cats and kittens. It's called Revolution Plus. It kind of does all of the things, the fleas, the ticks, the intestinal parasites, the ear mites, all of that good stuff. When they get a little bit bigger, then they're old enough for Brevecto. They just have to be 6 months old in order for Brevecto, just because of weight, because these guys like to grow like little weeds when they're this size. But once they kind of, get through that 4 month stage, we don't see them back until about 6 to 8 months for their spay and neuter. And the reason why we like to recommend that, especially for cats, if your cat's going outside, it helps with population control. We've all seen our fair share of outdoor kitties here in the central Kentucky area, and it just helps with population control on that front. But then it also helps prevent cancer development in those reproductive organs later on in life, whether it be mammary cancer, ovarian cancer, or testicular cancer. If we go ahead and spay or neuter these guys at a younger age, we significantly reduce the chances of developing those cancers later on in life. And then from there, I like to see them every year back and just do an annual wellness checkup, get their vaccines up to date, make sure that everything looks good, that their bellies feel good, that their teeth and gums look healthy. And usually starting around age 3, we generally start running, some general lab work, some blood work here, just to make sure that everything internally looks okay. Because as we know, as any pet ages, they can develop some things like kidney disease or liver disease, or maybe some things going on with their thyroid, and we just want to make sure that we're keeping them happy and healthy for as long as possible.
So, I know you've already mentioned some possible conditions, but what are some other possible conditions that can be avoided with cat preventative care?
Yeah, so, we do see some of the things that we can vaccinate for, like feline leukemia, that can be developed if the cat's not vaccinated before being exposed to that, and that can have a really negative impact on life. Sometimes those guys get really sick, and sometimes they don't always make it. If they do go outside, keeping them up on their intestinal parasite deworming, because we can see it, if they've got little bodies, and if they've got a lot of worms in there, then they're giving up some of those nutrients, and it can cause some really severe GI symptoms and kind of, you know, cause a lot of weight loss or things like that. And so just to give an example of some, you know, those are things that we can definitely prevent against that could be nasty if caught.
So why is it important to avoid self-diagnosing my cat?
Cats are special little creatures. They're also incredibly stoic. And so I feel like as veterinarians, we kind of learn this art of reading cats and interpreting what they're telling us. And there's just, you know, cats aren't just little dogs. There's a whole slew of things that are significant and special to cats. And I think a lot of things can be misdiagnosed or maybe misleading, and I think there's some things that we think, oh well, you know, my dog did this and we did this for my dog, so that would be okay for my cat, and a lot of times it doesn't work like that.
So my last question is, what are the risks of failing to provide preventative care for my cat?
Yeah, so it's just the possibility of, you know, disease contraction. Oh, bless you. You know, picking up parasites, both internal and external. And then, you know, we can run the risk of, you know, maybe a cat develops diabetes later in life and it goes undiagnosed, and that can be really detrimental to any pet. And so it's just, you know, it's life shortening, bottom line, and preventative care and preventative health care can really make a difference in the long life of these guys.
All right, thank you, Dr. Hill.
You're welcome.